I've been involved in Lourdes for a lot of years, over 35 years. What I've seen in that time is the commitment of the hospital to the mission.
The Franciscan Sisters of Allegheny started Lourdes in 1950, and they really brought their values and their outlook about how healthcare should be delivered.
The people are important. They're not just patients, they're important. And we fix you health-wise, but we also care about you.
I interviewed with Sister Elizabeth. Here I was in my early 30s, and what I wanted to demonstrate in my mind at that time in the interview is what I knew about running hospitals. And the interview really was nothing about hospitals. It was really about, how I fit into the culture here. And I think that really just said a lot to me about, this organization.
We had in the early 80s an opportunity, a cardiac surgery group who was not practicing at Lourdes came to Sister and asked if she would be interested in taking the practice in at Lourdes. And Sister came to the board meeting and she said, I've got this great opportunity and I think it's probably a good decision. But I must say that for us to be able to accommodate them, we'll need about $1.5 million. And she said, well, you know what? It's the right thing to do. God will provide. And 3 months later, someone passed away and left Lourdes $1.5 million. We had this wonderful opportunity to have the New York Times come in, spend a couple of weeks to evaluate our cardiology program and how we deal with heart attack victims. Sunday New York Times, front page, picture of Lourdes, raving about how we're now dealing with heart attack patients and how quickly we're doing it and how it's state of the art. It was all driven by the commitment to do a better job. And that's what the article said. As much as we've grown in cardiology and in Lourdes care and all the things that we're doing, I don't think we've ever lost sight of our mission. You start with the statue. It's a beacon for Camden. We treat all patients, and we treat them all the same. And I think the people of Camden cherish it. They know they can go to if they're not well, and they'll be treated well. The mission of Lourdes, a strong commitment to the people of Camden. We were here to provide for the people who couldn't provide. You can't get rid of the mission culture. It's here. And it started with the Franciscans, and it stayed. I'm serving Lourdes because Lourdes is serving Camden. I think there are a lot of services here at Lourdes, and you can select where you want your donation to go. Mine go to general areas. I let the hospital decide. There are just so many areas where we've touched lives and saved lives that you have an opportunity to support them. Wherever you spend that money, it will be well served.